12th of January. We made it to the 12th, guys. So we are not doing too badly. And, you know, nearly halfway through January. Are we nearly 12, 24? Yeah, we're nearly halfway through January. So come on, it's going well. It's going well. I currently on my Wi-Fi have one tiny little dot. It's got like that sort of ray. It's got one little dot. So that probably means my Wi-Fi is not very good. So hopefully this will all work. You'd have thought someone of my standing would have a good Wi-Fi, wouldn't you? I would have thought so too, but just shows you how wrong you can be. So let's see how. If you've got any questions, and I tell you something that's happened on Instagram. People, I say people plural, 2 people have asked a question on the live, on the story where it says ask a question. And they're both the same question. Look at that. I can access them at the touch of a button like that. Look at that. I know exactly where they are now, so I can access them. So if you have got any questions, I don't think you can use it now. Well, I don't know. Maybe you can actually. No, I think you can actually still use it now. But anyway, I am going to address that question/questions right now, because the question is, oh God, I pressed the wrong button. It's basically, is plastic surgery taking place during lockdown? That's question 1. Are your operations still currently going ahead? Question 2. So look at that, 2 questions on the Instagram, post on stories. So how's that going? Now, just for the viewers on Facebook, is that really annoying, that thing going along the bottom? A rhetorical question. I'm taking it off anyway. So basically, is surgery going ahead? A lot of people are asking this question about, is surgery going ahead during lockdown? And the answer that I give is prefaced by the fact that I am giving my best knowledge as of this moment in time. So or at 12th of January, and I haven't looked at the news recently, so it might have changed. We're playing. The first thing I'm going to say is that if you've had surgery, if you're a patient of mine or if you're a patient of ours, and you have had surgery, or you have a clinical problem and a clinical need, we will see you. I will see you. We can see you at the clinic if you have thing to say. And to be honest with you, that's always been the case. That was the case even during the first lockdown. If you had any problems, you were allowed to go to seek medical help. And I think there was a bit of a feeling that some people felt they couldn't seek medical help, and therefore the hospitals, things were getting missed, and that wasn't good. So this want to stress that if you do have a medical need, then you definitely can come to the clinic. Now that then brings us on to, because we are able to see people at the clinic is open. I am able to see people and treat people with a medical need. Said that, if you sound keeps cutting out. It's the one. Is it Wyatt Louise? It's the Wi-Fi. It's the Wi-Fi. It's got 1 bar. You know what? I've got another Wi-Fi on it with all the bars, and I've clicked on that one, and it's not going to it. I think it's something to do with the Wi-Fi under there. Well, I think it is. Is it the Wi-Fi or is it the microphone? Hello 21212. That's got dots going up. Sound isn't the best. Do you know what I can do? Switch microphones. 2-1, switch microphones. Microphone 2. Microphone 2. I know it's working fine on Instagram. Instagram's on my phone. Facebook's on my computer. Fancy. Facebook's got all sorts. Look what I can do on Facebook. Do stuff on Facebook. Background. Look at that. I can get a background on Facebook. Actually, perhaps I shouldn't do that, because that's probably going to make things worse. Apply the background. Does that apply? Anyway, Sarah, you heard me. I've got 2 microphones set up. So there's a second microphone, and we're on microphone 2 now, I believe. Yeah, which is this one. Microphone 2 on 2 on 2. 2 on 2 testing. I mean, this current microphone has got suspension. If you're going over bumpy ground, it's got suspension. It's got the lot. So hopefully this will be okay. Is that all right? How's that? Anyway, Instagram's all right, isn't it? Instagram's got no microphones whatsoever. Instagram's just the phone. Sometimes I wonder the technology they can get into a phone. How come they can't get it onto a... suspension's not all hooked up. That's the rubbish one, says Khan. Sorry, Khan. Can I... Excuse me? What's the rubbish... How very dare you? That is top of the line, Khan. It's got a little green light. Can you see a little green light? It's got a little green light in there. Honestly, it's top of the tree. It's got a stand for it, Khan. Honestly. That one's good. Mic 2 is rubbish. This is mic 2, Sarah. This is mic 2. I'm on mic 2. 2 on 2. Sorry, Instagram. Bear with me. We're getting mic issues on Facebook. This is mic 2. So is this one any good? Mic 2, mic 2. Can you hear me? Can you hear me? Little brown fox jumps over the whatever, whatever that thing you say. Actually, that's typing, isn't it? Anyway, I'm going to go on mic 2. If mic 2's bad, by all means, chip in, and I'll go back to mic 1. If mic 1's bad, what else have I got? You know what's good? Those little earphones. I don't know if you can plug them into the computer. Those little, those little ones you get with the phone. Anyway, actually, you can't now because they've got the funny connection. Oh dear, oh dear. Need to get my IT team involved. Mic 2 is great, says Sarah. Khan says it's okay. All right, I'll take okay. I'll take that. Right. Well, we're talking about whether we can do the whether we can do surgery. So yes, if you've got a clinical need, if you've got a problem, by all means, we're definitely open. We'll definitely see you. We'll definitely treat you. No problem at all. Having said that, we are encouraging people to do things virtually. So we've set up all the diary is all set up so we can book you in for a virtual appointment, and then you get a link where that leads you to a video like this. same cutting edge technology is used in the video consultations, cutting out sound and dodgy microphones. So we can do a virtual consultations, and we're encouraging people to do virtual consultations as much as possible. If you need to be examined, if you need to be treated, so if you've got a mole or a cyst or something like that, then we are still doing it. In the we're told if you can't work from home, if you can work from home, do, but obviously for examinations and for treatments, I can't work from home, because as it stands, elective surgery, planned surgery is still going ahead. So I can see you in the clinic for a consultation to examine you, or if you need a treatment like a mole or a cyst or a skin lesion removed, I can do it. And also we are still operating. So I did an operating list yesterday. So operating lists are still going ahead. Now they are few and far between because the majority of hospitals have been taken over by the NHS. However, there is some scope and there is some availability within some private hospitals to still do some work. So work as of this point in time, to the best of my knowledge, is still going ahead. It's really hard to be too reassuring, because if elective surgery stops, if planned surgery stops, then obviously we'll have to stop. Although, as I say, if you have got a problem, we'll still see and treat you. But and I've got to be honest, it doesn't look good, does it? Let's be honest with ourselves. The news is never good, and it is not looking great. And speaking to my colleagues in the NHS, it's just bad. And so it may be that we will stop planned surgery. But at the point in time, we are still doing planned surgery. Having said that, we're trying to do less sort of smaller operations, in terms of we don't want to do the really big ops The really big ops, anything that could potentially put stress on the NHS, that could potentially require an inter-hospital transfer into the NHS, or is going to be a bad thing. And also the thing about the big ops is there is some evidence to suggest that if you have surgery and go on to have COVID, after surgery, you're going to get a worse outcome. And that's more of a risk with the bigger ops and people with more comorbidities. So we're trying to avoid doing bigger operations. We're trying to avoid treating people with comorbidities. What I mean by comorbidities is other problems, other medical illnesses or problems. Although, to be honest with you, we don't treat many people with comorbidities anyway. But as much. I mean, we would, but it's just most people are fit and healthy having this sort of surgery. So yes, in answer to the question, yes, everything is going ahead at this point in time, but we are monitoring the situation regularly, and we are very aware that if things don't start getting better soon, it may be that all surgery will be stopped. But at the moment, we are still doing minor surgery at the clinic, and we are still doing bigger operations at the hospitals, albeit significantly less than normal, simply because of availability of hospital space. So there's much less hospital space now than there used to be, and that's been the case for quite some time. So when hospitals do have some space, we do take it, and we will treat you. So obviously there's so there is availability, some availability, but yeah. So as of now, yes is the answer. We're seeing and treating people. I saw a question from Danny up here ages ago when I was messing about with the microphone. Do you still carry out surgeries yourself? Yes, I do, Danny. I do carry out surgeries myself. I stopped for about 8 months. Crikey, when was that? God, last year. Just seeing, I would have said last year, but it wasn't last year, was it? It must have been the year before. To build the business, and I have built the business. The problem is, or the problem I've got is the waiting list was getting crazy, and my business is based on giving a good service to people. I thought to myself, I'm not giving a very good service here because everyone's waiting for a long time, and it wasn't it so the waiting list was getting longer and longer. So I started again now. We've got other surgeons at the clinic, and we work together, so there are more of us. My goal and my plan has always been to have other surgeons working with me at the clinic, because I've always been about delivering a really high quality service, and I believe you can't deliver a high quality service and a high volume service. You can't. And one of the risks I find, or I've aware of in other practices, as people get busier, they start to give a worse service because they get busier and they can't spend so much time with patients, and they're rushing in and out of clinics, and that's right. Whereas I like to have a bit of a chat and a bit of time. So I thought, if I'm going to scale my business, I have to get other like-minded surgeons working with me, and building up a team where we all feel the same way and look after people, and all fully trained. So it's another thing I go on about: highly trained, fully trained plastic surgeon. I've written a book about it, actually, Danny, since you ask. Yeah, I have written a book. Yeah, just here. Okay, Kim will be happy plugging the book. Never accept a lift from strangers: how to choose the best plastic surgeon for your cosmetic breast surgery. Available in all good bookshops. Actually, it's not available in bookshops. It's available on Amazon though, or from my website, or from my clinic. Come and we'll give you a copy. If you order one from the website, never accept a lift from strangers.com, we'll send you one free. The book's free, but you pay postage, which I have reason to believe is $3.95. I think it is. I keep on seeing $3.95 in my bank account. I think that's the book sales. Bolstering up the revenue streams. That's what it's about. Multiple revenue streams. So yeah, in answer to your question, Danny, I am doing surgery. Yes, is the short answer to that one. Yeah, that's probably JJ did my tummy tuck 11 weeks ago. There you go. That proves I'm doing surgery, because I did my private journey's tummy tuck 11 weeks ago. So I was doing surgery 11 weeks ago, and I did some surgery yesterday. Was it yesterday? Recently, anyway. You're welcome, Danny. Yes, thank you for asking the question. Looking better. Hello, new you with a beard. Yep, new you new new beard. Well, it's not a similar beard to the old one, but I got it back again. Yeah, I got it back a few weeks ago. Thanks for noticing, Kelly. Very kind of you. Sadiq says good night from Indonesia. Good night, Sadiq, and multinational audience here. So thank you, Sadiq. Nice to see you. Sarah, let's just leave that on the Facebook. Sorry, you can't see this Instagram. Best customer service ever, says Sarah. I've got to be honest, Sarah. I do work hard at the customer service, and I do think it's important. Customer service, aftercare, looking after people. That's the thing that I focus on, and I work hard to do. So that's very kind to hear that, and that very, 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 very good patient too. And my private journey agrees. Thank you for that. Yeah, both of you, very good patients. See, helps patient selection, very important. Hannah Dudley, would you do a tummy tuck and inner thigh lift together? Well, two parts to that question, Hannah. First part of that is, would you do it together normally? And the second part to that is, would you two do it together at the moment? And so normally, yes, a tummy tuck and inner thigh lift would be reasonable to do together. Both pretty big operations, but it's not an unreasonable combination. They're in the same area, which helps in terms of draping and prepping, because you've got to think, if you're prepped and draped having surgery, if you're having your sort of thighs and your arms done, it can be a bit of a problem because you can be exposed and get cold and things like that. So that's an issue. So it's quite nice that they're in the same area. They're sort of next to each other, the tummy and the thighs. So yeah, under normal circumstances, it will be an acceptable combination for surgery. However, we're not in normal circumstances, Hannah, and at the moment, I think, particularly at the moment with this lockdown, it was probably going to be a no, because it is one of those ones which is a bigger operation. Increased risk of complications, increased risk of, as I say, there's some evidence to say that if you have surgery and have COVID afterwards, you're going to get a worse outcome. That might be worse for the bigger operations. We're trying to shy away from the bigger operations. Also, any risk that you might get ill or need any help from the NHS is not going to be good. So we're trying to not do surgeries where you might, have more complications. So I would say at the moment, it would probably / definitely be a no at this present time. So you've got two options, Hannah. You either stage it, so you have one and then the other, or you wait, because if the vaccine gets rolled out, well, not if the vaccine starts having an effect and things start becoming more relaxed, then we might be doing bigger operations again. Because as I say, under normal circumstances, it would be fine to do those two things together. Thank you. Some clinics say they do, others say it's dangerous to do it together. Is that true? Thank you. So I wouldn't say it's dangerous to do them together, but I would say it's increasing your risk of complications. It will knock you back a lot. A tummy tuck's a big deal. Then you have both thighs. It is a big deal. And you've got increased risk of complications, no doubt about that. I think dangerous is a bit of an inflammatory term, but certainly I would say increased risk of complications, and it's going to knock you back having a longer operation and having tummy and thighs and all that sort of stuff. But sometimes people want it because they want one period off work, etc. Nicholas Swain, unless you're talking about at the moment with COVID, you might be saying it's dangerous because of the COVID. I'm a prison custody officer, so my job is quite physical. How long should I have off work after a tummy tuck? Well, if you can't not do physical stuff, so 3 weeks, I would say, for sort of to be sure, for driving and doing non-physical stuff, so desk work and things like that. So if you could do desk work, light duties, phase return, whatever, then I often say after 3 weeks you can start getting into that sort of stuff. But nothing physical for about 6 weeks, I would say, before you start doing physical stuff. So the question is whether you can do anything, you're able to do anything in your job in a non-physical way. So what I often do is I give in a non-physical way, I often give a sick note, and I'll say 3 weeks off, 3 weeks light duties or phase return, and it's up to your employer to see whether they can give you light duties. And if they can't give you light duties, you might have to be off, but because you don't really want to be too physical. in the first, I would say 6 weeks after a tummy tuck, is going to be pretty uncomfortable. What's going off? JJ to my tummy tuck 11 weeks ago. Yes, I agree. Best belly buttons too. Says we got an endorsement for the belly buttons there. Thank you on Instagram. UC Biodoll wants to join your video. I'm going to assume that is a mistake, UC Biodoll, because usually in my experience people do that. Go live. I can go live. It's a mistake, and I just end up in your living room, and it's going to be awkward for all concerned. So I'm going to ignore it. I don't know if Instagram people can see when people have requested or not. Thank you. Hannah says Tracy Windler. Is that tagging someone? Have you just tagged Tracy Windler? Is that what that is? Not up to speed with the Facebook thing, but anyway, it's fine. So I'm assuming you don't want to be live with me, but right, we've got a question here, guys. Is kenalog cream good for keloids? No. Ooh, no. Well, full disclosure, I didn't know they did kenalog cream. Kenalog, I thought was the injection, but maybe they make it in the cream as well. But basically, kenalog is a steroid, quite a strong steroid. And steroid is good for keloid, but not topically, not as a cream. I wouldn't put steroid on the skin for keloid. That's not going to help a keloid scar. So what you have to do for a keloid scar is you have to inject steroid into the scar. I usually use triamcinolone rather than kenalog. Kenalog's a slightly stronger version of steroid than triamcinolone. Don't want to get into the nuances of it all. Sorry, not triamcinolone. Adcortil, it's called, which is 10 milligrams per mil, as opposed to kenalog, which I believe is 50 milligrams per mil, I think. But anyway, nevertheless, they're both steroid, and you have to inject the steroid into the scar. So there's no good just putting steroid on a keloid scar. If anything, it could do some harm. It could thin the skin, and it's not going to do any good. The evidence for steroid is in an injection into the scar. So you have to get a doctor to help you with that. That will have to be a doctor will have to do that for you. So don't steroid cream on the scar is not going to cut it. Kelly, I'd love to see your tummy tuck work. Kelly, you can see it. Do you know what? It's really hard to. I've got a list. You know what it's like? I've got a list of things to do. I need to sort out the website and make it a little bit easier. We looked at it. Well, again, I was going to say last year, but it's not, because last year was I can't get on my website. Okay, so is the internet really bad? Am I really still got one dot on my? Oh no, I'm on. I'll send a link, Kelly, for some photos. It's about halfway down the page. It says view examples of our work. That's my fancy way of saying look at before and after photos. I think I probably would have been better just saying look at before and after photos, because a lot of people say, oh, there's no photos on the website. I'm like, oh, actually, you can go to the normal page, but videos age restricted. God, it's amazing when you start looking at your own website. I'll put the link in now, because that's the kind of guy I am. Just live, type something. Didn't actually put any. I just put that there. Have I put the link in? Oh, yes, I have. There's some photos of tummy tucks there. Hold on a minute. I'd love to see your tummy tuck work. Hannah Dudley, hand up. Is that another tag? Are we getting tagged? We're tagging people, guys. Yeah, let's get tagging. That's how we influencers grow. You guys tagging, isn't it? Tag. Please comment and share and tag. Nice. Hannah, what would make you advise a patient to have an FDL tummy tuck rather than a tummy tuck? Would one give different results to the other? Yes, they would, Hannah. They give different results in that an FDL tummy tuck, which is fleur-de-lis for those of you who don't know, is more scarring, bigger operation, more risk of complications, but more skin is removed. A normal tummy tuck, you're taking the lips out from the belly button to the pubic area, then it piece to the side, and you tighten the skin in an up-down direction. A fleur-de-lis, you're taking the lips out that way, but also a lip side to side. So you tighten the waist, you bring the waist in as well. So it does give more skin removal and it does give more skin tightening, but there are more risks because you have a T-junction, you have an inverted T-shaped scar, and also it's unsightly. The scar goes straight up the middle of your abdomen, which is unsightly. I don't particularly like the scar, but it does take away more skin. So an FDL, a fleur-de-lis, is really for people with a lot of skin. So it's people who've had massive weight loss who need more than a tummy tuck, which could therefore be an FDL, a fleur-de-lis, or a circumferential 360. Both of these give more skin removal, but more scarring, more risks. And so, yeah, more of a result, but more risks and more scarring. So, yeah, good question, Hannah. Thank you. What do you advise for the incisions after surgery? I normally leave it about 6 weeks, Kelly, and then after about 6 weeks, I get you massaging them. Get you massaging them with cream. Doesn't really matter what cream. We sell some stuff on the website. I can't remember what it's called, but to be honest with you, it doesn't really matter what cream you use. If you have a normal moisturizer cream, Nivea, E45, aloe vera, aqueous cream, whatever, then just massaging it with cream. As I say, leave it about 6 weeks to get it settled, and then get massaging it with cream. A bit of pressure on the scar, blanch the scar. The scar's a bit red. It's often a bit red and firm, especially around the belly button. It can be a bit tight. Bit of blanching, bit of pressure, just to help to soften it and settle it. There are some creams like silicone-based creams and ointments, which are quite expensive, which are marketed as scar reduction creams. I don't normally recommend them unless you have a lumpy scar. If you have a lumpy red scar, like we were talking about a minute ago, keloid scars, different kettle of fish. There are things you can use for that, like the steroid and like the silicone. But for normal scars, it's very rare to get keloid scars in that area. For normal people, they just get red, raised. Not that people who get bad scars aren't normal people, but for most people, should I say, they just get slightly red, raised, firm scars, which you need to massage and moisturize. And for me, it's more the massage than the actual cream that you use. What is kicking off? God, Instagram's kicking off. My private journey. Follow me on Instagram. I'm documenting my surgery recovery. All is good. Is that for me? Am I supposed to follow you on Instagram, or is that for the people, for the other people? Hey guys, follow my private journey on Instagram for the journey of surgery, because it's all good so far. Is a tummy tuck, lipo, and breast lift with no implants safe to do it at once? What BMI is needed for that? Right, UC Biodoll. BMI, two things about BMI. One is the absolute number of the BMI, and the other is the what you think about your weight. So the absolute number, if you want an absolute number, is 30. Ideally, BMI below 30, you're going to reduce your risk of complications compared to a BMI above 30. Now, there's nothing magical happens at 30, but that's where they've done the studies. They've usually looked around a BMI of 30. So ideally, you need to get it below 30, but you need to be happy and stable with your weight. So even if your BMI is below 30, if you're not happy, if you want to lose weight, it's always best to do it before surgery. You don't want to have weight fluctuations after surgery because that can affect the result. Similarly, if your weight's above 30 and you're happy and stable with it, particularly for people who've lost a lot of weight, some people have lost a lot of weight, but they've still got a BMI higher than 30, you could potentially still have surgery, but you'd be a high risk, bit more difficult around this time. And the same with your question, tummy tuck, lipo, and breast lift with no implant. It's borderline, and I would say it'd be a case-by-case basis whether that will be done at the moment, because we're trying to not do bigger operations, and that's pretty big, to be honest with you. Tummy tuck with lipo and a breast lift, that's up there. So it's borderline. I wouldn't hold your breath for getting that done. I would say that would be a case-by-case basis. And I think UC Biodoll has actually tagged people, have you? Which is great. Thank you very much. Anyone, it's for anyone. My private journey, anyone. It's not just for me. Tracy Finch, I'm so pleased with my TT, looking good 10 weeks post-op. That's the sort of, and honestly, that's a real person. Okay, that is not, it's not me. I haven't just typed it. That is a real bona fide human being. Look at that. That's what we need. Thanks, Tracy. Very good of you to comment and to say that. And I'm very pleased that things are Good so far. 10 weeks is early days, so your scars are probably red. So get massaging them, and they do take a few months for everything to probably settle. But that's good news. And my private journey, also your, what did you say, 10, 11 weeks. So that's, still early days, but good news. Good to have a bit of positivity there. Thank you for that. Do you know if you were to have a tummy tuck with the NHS, would they also do a Mons lift? Regardless of the NHS, I think first thing I say is it's difficult to get this sort of surgery on the NHS. But if you can get this sort of surgery on the NHS, then I would say, as a surgeon, you would try and do as good a job as you possibly can, whether you're doing it on the NHS or privately. So I wouldn't try and do not as good a job if I was doing it on the NHS. You're limited to how much of a Mons lift you can do at the time of a tummy tuck, because you don't want to try and lift the Mons too much, because if you lift the Mons too much, the scar will drift up. And you'll end up with a scar goes hip to hip and then it goes up in the middle, and doesn't look good. So you don't really want to dissect down south too much to do your Mons lift while you're doing a tummy tuck. So you are limited. So if you have got a very prominent Mons and you do need a Mons lift, this is in my hands and my experience, you could do something for the Mons and you could try and address the Mons, but you can't do too much to the Mons, NHS or private. And as I said, they've agreed to do something on the NHS. I would hope that they would make it as good as they can and do everything that they possibly can. That's what I would do, even in the NHS. So I don't think that should make a difference. But I think you'll struggle to get it on the NHS, to be honest, in this day and age. But, Tracy says I'm definitely real. But Tracy, I would have written that if I was you. But anyway, she is definitely real. I haven't typed anything. I haven't got a team next door. All right. But that is an idea. Team of, he is a very good surgeon and he did my surgery. Go to him. That's good. No, thanks, Tracy. I know you're real. Good. Keep it real, girl. Keep it real. That's good to know. Yes. Good luck with that, Kelly. If you are getting on the NHS, that is good to know. Right, what's going on? Instagram is kicking Instagram. Look at that. UC Biodol. Do you need lymphatic massages after tummy tuck? When is it safe to start? I don't routinely offer a lymphatic massage after tummy tuck, so I don't think you need it. If I thought you needed it, I would offer it. When it's safe to start, I would say about 6 weeks before you start doing those things. You want to be properly healed, properly knitted together. But you probably want to speak to the person doing the lymphatic massage, but I would say about 6 weeks. And certainly do no harm. Well, as long as you don't do it too soon. Sabotage. Do you remove the nipple with breast lift stroke reduction? Good question, Sabotage. A lot of people think you remove the nipple. No is a simple answer. There is a technique of breast reduction for massive breast reductions where you literally remove the nipple and then you put it back on again. Excuse me. It's called a free nipple graft. In my practice, it's very rare, and it's really for people with very large breasts. The vast majority / all, pretty much all other patients will have the nipple kept on what's called a pedicle, which means you cut around the nipple and you remove all the skin around it, and then you remove some skin, remove some breast tissue if you're doing a reduction, just skin if you're doing a lift, and you mobilize the breast and bring it up, and you just keep the nipple attached on a stalk of tissue, and then you bring it up to the higher place when you're doing the lift. So you don't actually remove the nipple, you just sort of release it and bring it up, and you keep it attached on what's called a pedicle. Hard to explain. I don't know if I've got videos of a breast reduction. Sure, I feel like I have on YouTube, probably got a video of a breast reduction with a sort of where you can see the pedicle move. I'm not sure if I have, but I should get one if I haven't. UC Biodol's back. Good to see you back. What's happening over on Facebook? Kelly, I'm actually on the waiting list. Well, there you go. So much for me saying you can't get it on the NHS. It will be 2 years or so before I even get an answer. Also, my weight has maintained. Then hopefully they will say yes. Well, that's good, Kelly. So excellent, Kelly. Well done. You're on the waiting list. So that's good news. And let's keep everything crossed for that. Is there a link between COVID-19 vaccine side effects and breast implants? Where's that question? Here we go. I've been offered the vaccine as I'm a carer. I've heard there's a link between those that have breast implants and side effects from the vaccine. Could you advise me as to whether I should have the vaccine or not? I can't advise you on that. And I think the person doing the vaccine really is the best person for that. I know there are risks if, I mean, I'm not an expert. I've got to say that early on. I am not an expert on this. So, take it, take it or leave it, this advice. But I know that there are some risks with the vaccine in terms of anaphylaxis. So if you've ever had an anaphylaxis, if you've ever had a significant event or a side effect from having an injection, then you've got to be careful having this one. But I don't think there's any problems with implants, having breast implants, or a link between those that have breast implants and side effects of the vaccine. No, I don't think so. And obviously, you've got to temper any side effects of the vaccine. Obviously, if you've got a high risk of getting a side effect, you've got to think about it. But you've got to temper that against the benefit of having the vaccine. And certainly, I don't think breast implants is a problem. If you've got breast implants or are thinking of having breast implants, there's no problem with having the vaccine. You would be able to go ahead with it. Tell the vaccine deliverer that you have breast implants in, to see if they say that's a contraindication. But I'm not aware of anyone who's had that as a contraindication, and I don't think it is one. But you best to check. Um, are you getting the vaccine, JJ? Funny you should ask that. I just got a thing to book it today. I will. Yes, I will. I haven't got it yet. I've got to find a time to do it. But yes, I will. I will be getting it at some point. So, yep, I think it's gonna hopefully help, and I think the benefits outweigh the risks. So yeah, go for it. I have a water sport holiday booked for September. Can I consider breast reduction surgery before, or shall I wait until after my holiday? September. What are we now? January. Well, September's quite a long way away, isn't it? 8 months. I would say it depends on when you are thinking of having the surgery. So it's potentially doable before. You probably want to give it a few months to get it all healed up. But as a general rule, when people ask this sort of question, the, when people ask this sort of question, the timescales are usually shorter. So September, I guess it would be reasonable if you could get the ball rolling, and if you could get a surgery date relatively soon, or at least in the next few months or a couple of months, then I think it probably would be fine. But as a general terms, when people ask these sorts of questions, my gut feeling is that if you have got something booked for September, what if, perish the thought, you could never guarantee that you might have some wound healing problems, might have some asymmetries, some dog ears, some issues, some bumps, some lumps, some pain, some discomfort, whatever. Don't put yourself under pressure. So I normally say to people, look, why don't you just have it in October? Once you've had your holiday, great, have a great time on your holiday, and don't put yourself in a position where you've got, maybe potentially a bit of tenderness, a bit of scar that's uncomfortable or something. So in general terms, when people ask these questions, my gut feeling is just to do the thing, whatever it is, and then have the surgery afterwards. But yeah, say if you left it 3 or 4 months, 3 or 4 months before September, when's that? I don't know. Anyway, it's not yet, is it? You've got a few months before. You got a few months before you're a few months before September. If you can follow that stream, yeah. So if you can leave it, if you got 3 or 4 months to heal, then I think you'd be all right. So I would maybe start asking the questions, see when you can get seen, see when you can get some potential dates, and then work it out from there. If you can't get a date, in that time scale, then maybe have it afterwards. But if you can, then yeah, maybe. What's going on? UC Bardot, how do you get a high hemoglobin before surgery? What number do you refer? How do you get a high hemoglobin? Um, I don't know what you're saying there, UC Biodol. I mean, the main thing with a hemoglobin is you want to just see what your baseline is, what your hemoglobin is now. So I wouldn't try and get a high hemoglobin for surgery. I'd just see what it is now. I mean, if your hemoglobin is low, then you've got to think, why is it low? And is there a problem with, bleeding or dilution, or what's the issue? And you might need to be investigated. And there are things to get it up again, like blood, for instance. That's maybe a bit extreme, or iron, assuming it's an iron deficiency anemia. But yeah, but I think the first thing is to look at the baseline, and if it is low, look at why it's low to see if there's a cause for it to be low, and then to treat that cause, and then to get it up, you would do things like as I said, blood transfusion will get it up straight away, or iron tablets, or you might be functioning quite well with a hemoglobin as whatever it is. There is a range of normal numbers. But yeah, if your hemoglobin is low, then you need to get it checked out. And if you are being investigated or treated for a low hemoglobin, we would talk to the person who is treating you for that in terms of timing for surgery. Can you do an implant replacement and lift without the lollipop scar? Yes, you can. So it's Bex. It can be done. I wouldn't do it though. I don't do a lift without the vertical scar. You can do a lift with just a circumareolar scar, with just a scar around the areola, but it's called a Benelli lift, and I don't think it gives a very good lift personally. So I don't really do it. I would always do either the lollipop or the T, even putting one in the fold, to give more scarring but more of a lift. I understand why people don't want that scarring, because they don't want any visible scarring, and if you just have a scar around the areola, it's going to be less visible. But I don't like that lift. The scar's puckered and flattens the breast, doesn't give projection, so I don't like it personally. But it can be done, Bex. It can be done. How long does a breast lift with no implant last? Well, what it does, UC Biodoll, is it sets you back to a better place. So it's important to stress that it doesn't lock you in. And the fact that you've asked the question means that it implies you know that it doesn't lock you in. It doesn't mean they're going to stay there forever. It gets you back to a better place. But over time, they do droop again. Droop again. Depends on how big they are. So the bigger they are, the more they're going to droop. So if you make them smaller, that would give you a more long-lasting result. And the other things are, if you put on weight and lose weight, that will make them droop quicker. And if you become pregnant, that will make them bigger and smaller and stretch the skin and make them droop. So those things will make them droop quicker, but they will naturally age and droop over time, as they would if you hadn't had the lift. But it just sets you back to a better place. So I don't normally say, oh, it lasts 10 years and then you need it done again. You never need it done again, but over time it will droop, and it will droop more quickly, as I say, given the above things. So I hope that doesn't feel like a cop out, but it's hard to say. What's this one here? Go live with, oh my God, I've got loads of people. Farah Man. I'm assuming it's all like mistakes. When would you use dissolvable sutures over ones you have to take out? I did this question on a Facebook Live in the past, and I cut it up and I put it on YouTube called "When Would You Use Dissolvable Sutures" or something, and I got quite a lot of comments saying that I didn't answer the question and it was all a load of rubbish, basically. And it's tricky to answer the question. That's why this stuff is tricky. You can't just say you use dissolvable sutures then and you use taking out ones then. I mean, broadly speaking, when you're putting stitches underneath the skin, you use dissolvable sutures. And so dissolvable sutures you usually can't see. They're dissolvable sutures, they're underneath the skin. They're to take the tension off the wound. When you have to, so you use them a lot underneath the skin. There are some situations where you might use a permanent suture underneath the skin if you want it to be really strong for a really long time, like for instance a tendon repair. If you're repairing tendons, then you do use a permanent suture to that tendon, because you really don't want it to dissolve. You want it to give the strength the whole time. So broadly speaking, sutures underneath the skin are dissolvable. Now, when you have a skin wound and you're closing the skin itself, so you'd often put some dissolvable sutures underneath the skin, and then when you have that last layer to put in the skin, you can choose to use a dissolvable or a permanent suture. The benefits of a dissolvable suture, obviously, that you don't have to come back and have your stitches removed. The downside is that if you put normal stitches in, you get those stitch marks, those dots, if you have used a dissolvable suture, because it might take a while to dissolve. So what you tend to do is you put it underneath the skin, you bury it underneath the skin, what's called a subcuticular suture. So you bury it underneath the skin. Now, you often can't get quite as good alignment with the eversion. You need to evert the wound. That's what you do when you're closing a wound. Get the wound edges like that. It's a bit more difficult to do that with a subcuticular. So if you really want to get the best possible scar and evert the wound and line up every stitch accurately, you're much better off doing an interrupted suture with a non-dissolving suture. But that has to be removed. and if you leave it in too long, it can give stitch marks. So you want to remove it relatively quickly. So the only place, not the only place, but the common place we tend to use that is on the face, because the face heals really quickly. So you can take those stitches out in 5 to 7 days, and we want a better scar. So we usually use non-dissolvable sutures in the face to stitch up the face, because we want to get that really nicely everted, best possible scar, and we know we can take those stitches out in 5 to 7 days. On the trunk, on the body, you need the stitch in for longer, so you would be more likely to use a subcuticular stitch. If it's a very small incision, it's very hard to use a subcuticular, so you might use an interrupted. And if you did want a bit of strength there and you weren't so worried about the cosmetic outcome, you might use interrupted sutures like a leg or the back. If you're worried the wound's going to open up, those interrupted sutures with the ones with the stitch marks are stronger, so you might put those in and maybe leave them in for a couple of weeks, and maybe accept that you might get some stitch marks, but you're doing it for strength and to bring it together. So broadly speaking, non-dissolvable sutures on the face, because we know we can take them out in 5 to 7 days. Dissolvable sutures on the trunk, broadly speaking. If you want extra strength, you could use a non-dissolvable suture on the trunk, like for instance the back or the leg. And the other thing is, if you're having an infected wound, if you have trauma or something like that and there's risk of infection, you really want to have a non-dissolvable suture that you can take out in case you get an infection in the in the stitch. And so you probably would use a non-dissolvable suture if there was any risk of infection, or if it was a dirty wound with trauma and things. You'd put non-dissolvable sutures in, because if there was some localized infection, you could just take those ones out. I don't know if that was a good answer or not. I really don't. It's a difficult question. That's all I'm going to say. That is a difficult question. Is it safe to wear a farger with ab boards right after tummy tuck and lipo? To wear a farger with UC Biodol, what's a farger with ab boards? Sorry, I don't know what a farger with ab boards is. Right after, I mean, we give a binder. We usually will give you a binder. We give you one. Don't know what a farger with ab board is. Vilma Santos, long time no see, Vilma. I've seen some surgeries with tummy tuck and 360 4D liposuction was removing a large amount of fat. What would be the maximum safe amount of fat to remove at one time, in your opinion? I don't do high volume liposuction, Vilma. I think anything over 5 liters is a lot, and I tend not to go. I don't even go there. My normal fat removal is usually 1 to 2 liters. I think 3 liters plus is a lot, and I think 5 liters plus is pushing it a bit. In my practice, some people do large volumes. Some people do a lot more than that, but that's where I would be, Velma. I'm normally a 1 to 2 liter guy, and anything more than 3 liters would be a significantly big one for me. You've got to be careful with removing too much liposuction, but if you're experienced in it and you do a lot of high volume liposuction, you often have to be admitted overnight because you worry about fluid shifts and things, and you have to be kept an eye on. Then you can remove higher volumes safely, but you need to be someone who's doing it a lot, and I don't do it a lot, so I wouldn't be doing huge volumes. It's a compression garment, is it? Okay, a farger with ab boards. I tell you what, UC Biodol, I would refer that back to your surgeon. If your surgeon's me, I would say to you, look, we'll give you a compression garment, and if you want to bring your farger with ab boards in, I'll have a look at it. But yeah, I'd refer that to your surgeon. That's what I do. Is there a chance my cyst will grow back after excision? Yes, there is. That is a risk with cysts. And one of the things you've got to do with cysts is you've got to get the whole cyst wall out. That is why we have to make an incision the same size of the cyst. It's better if you can get the whole cyst wall out, then it's gone and you won't come back. If you leave any of the cyst wall behind, it can come back. That's why if you have a cyst and it gets infected and it bursts, you might think happy days, it's gone. But often it's just the contents that have gone. If the wall remains, it will fill up again. So it is a risk with cyst excision. So we very carefully make sure all of that wall is removed when we're doing the excision. What does a See&Treat appointment include? Do I need to book a consultation prior to the surgery? Yes, you do. Well, actually, Well, see and treat. Okay, see and treat is something that we do because we have got a we have got a operating room in the clinic. So I've got a clinic in Edgbaston and there's an operating room upstairs. Now, the difference between the hospitals where they have theatres, you have to book theatres and the theatres are all booked up and you have to book them all. So normally what happens is you go with your mole or your cyst or something like that and they say, yeah, we'll remove it for you. When do you want to have it done? We'll book you in and you come back and you have it done. But because I've got my own operating theatre and because we we only have one clinic at a time, we have one person in the clinic at a time, the operating theatre is available, it's not being used by other people, so therefore we can have this see and treat situation where we say to you, look, you can come, you can book in, we book in for a longer appointment. There's no problem if you don't want to have it done, but if you do want to have it done, there's the option to go. If you've got a mole, if you've got a cyst, if you've got a thing that's annoying you and you want to have it done pretty much, then you can book a see and treat appointment to come and have a chat with us. As I say, if you change your mind, that's fine, don't charge, we give you any deposit back. But if you want to, we can go ahead and do the thing, whatever it is, mole, cyst, or whatever, on the day. So you don't need to book a consultation prior to the surgery in those circumstances. For bigger surgery like tummy tucks and breast lifts, you do need to book a consultation prior to the surgery. So it's really for smaller operations, for the mole, cysts, the things we can do in the clinic, areola reductions, inverted nipple repairs, split earlobe repairs, removing tattoos, things like that. We offer see and treat appointments because I think it's good service. If you've got a mole, you want it removed, to come and say, look, there it is, can you remove it? And you say, yeah, I can remove it. Come back in 3 weeks and have it removed. You're like, well, I want to have it done now. So that's why we do it. And speaking of mole removal, how long after mole removal does it take to fully heal? It depends what you mean by fully heal. So skin will be healed in about 5 days, depending on the body. As I say, the part of the body, face tends to heal really well, and usually mole removal are on the face because that's where most people are bothered by them. On the body, a bit less, 1 to 2 weeks on the body, but usually skin healed after 5 days. So say 1 to 2 weeks, the skin will be healed. Now, that's just the top layer of the skin. Underneath, it does take a while for it to get properly healed. How far a man wants to join, I think I would assume that's a error. So the strength of the skin does take a good couple of months for the strength of the skin to get there. So whilst the skin will be healed in a week and it'll look okay and you can wash, you can shower, well, you can wash and shower straight away, to be honest with you, but you can sort of, get it wet and things like that. In terms of strength of the wound, it's going to be a couple of months. So I normally don't get you massaging the scar until about 6 weeks. And it's going to probably be 2 or 3 months. 2 or 3 months before you got strength in that wound and you can start really putting tension on it if you did do stuff like, I don't know, contact sports and things like that. Now, in terms of the cosmetic outcome of the scar, it can take 6 or 12 months for that scar to really properly fade. Sometimes you get numbness around the area and all these sorts of things. So it can take a while for it to really properly settle. But so it's a week to 2 weeks for the skin to heal, a couple of months for the scar to really start to fade, 6, 12, 18 months for the scar to properly fade, and any numbness and what have you, and contour irregularities to settle. So fully heal is a week or two, but fully settle is a year or more. Lucy Biodol, you're back. I don't know when you leave, Lucy Biodol, so I just keep on getting I'm back. So, but it's good to have you back, and thanks for coming back. I am out of questions here on the 12th of January, 2021. Hope January is treating you all well, and good God, let's hope this vaccine does the trick and brings the pressure off, and we can start going to the shops and stuff like that, getting our lives back. So yeah, if you have any questions, please do ask me, message me, get in touch, because you know what, I'm going to be here next Tuesday. What time? 7 o'clock, of course. Instagram, Facebook, YouTube as well. I don't think you can interact on YouTube. Can you interact on YouTube? I don't know if you can. Anyway, it's on YouTube as well. And 7 p.m. See you there. Thanks for coming. Thanks for giving up your night. What time is it? 7:57, nearly 8 o'clock. Time to watch the second Antiques Road trip. Channel 17, really. I'm going to get myself there. I suggest you do likewise. Jackie Crime says, stay safe. UC Biodol asks question, why don't you do installments plan? UC Biodol, we do installments plans. Well, we sort of do installments plans. We do installments plans for major surgery with the hospitals. The hospitals, you do 0% finance. Would that be called an installment plan? 0% finance? They do 0% finance for a year. In terms of sort of finance, we don't do it at the clinic. And I'll tell you why, UC Biodol, since you've asked the question. The reason we don't do finance at the clinic, I looked into it. And to be honest with you, there's the high street, the banks and, what have you, are giving really good lending money on a really good rate that we can't really match. So there's not really much point because you can go on the high street and get a loan better than what we could do. And so that's why we don't do it. But for the bigger ops, like the tummy tucks and the breast reductions and stuff like that, then there is 0% finance through the hospitals. But for the smaller ops that are done at the clinic, yeah, we don't do it because it's just not worthwhile for us. But good last minute question, UC Wild. I'll respect you for that. Velma says thank you. Thank you, Velma. UC Biodol says thank you. My Private Journey, Jane Thorne, all still here after all this time. Come on, guys. If you've not got something better to do, God bless. Come on, get yourself out there. See you. You know when, you know where. Take it easy and stay home. Protect the NHS. And, don't contact anybody. Probably said that wrong, but you know what I'm saying. The sentiment's there. And yeah, I'm staying home as much as I can, as I am now. And just you do likewise. I'm going to check out before the rambling gets any worse. And so you'll follow me on my journey. We'll follow you, UC Biodol. You follow me, I'll follow you. Let's follow each other on our journey.